Hey everyone, this is Dr. Boyd. Welcome back to Parently. Today we're going to talk about nausea and vomiting of pregnancy. This is a near and dear subject to most pregnant women. Now it's interesting, people ask me all the time, what is the cause for nausea and vomiting of pregnancy? Well, we don't have an actual cause. The theory is that the hormone that you use to diagnose your pregnancy in your urine, when you do a urine pregnancy test, you're looking for a hormone called HCG, human chorionic gonadotropin. Well, that hormone increases after you become pregnant and increases all the way up until about 15 or 16 weeks. Well, it's the rise in HCG that we think causes nausea and vomiting of pregnancy. Now, nausea and vomiting of pregnancy, even though it affects most women, it is not a severe problem for most women. Most women get by with a lot of techniques that we're going to discuss today. Now, it is important to understand that there are other causative reasons for nausea and vomiting of pregnancy. And if the nausea and vomiting of pregnancy looks like it's getting worse, despite the things we're going to talk about today, it's important that you see your healthcare provider. Now, a couple of examples of what else it could be. Gallbladder disease can cause severe nausea and vomiting in pregnancy. Ulcer disease can cause nausea and vomiting in pregnancy. And a condition called hypothyroidism. Your thyroid's a little gland in your neck. If you don't have normal levels and they're low, that can also cause nausea and vomiting in pregnancy. It's important to understand that the most important thing in nausea and vomiting in pregnancy is your diet and your fluid intake. Both of these are very, very important in decreasing the overall effect on your body. It's important to mention that many women ask me, is nausea and vomiting of pregnancy dangerous for my baby? The answer usually is no. Nausea and vomiting of pregnancy can affect you as a patient, especially if you become severely dehydrated, and that can be detrimental to your baby. But the great majority of women have very little problem or negative effect on their baby. Now, let's talk about both diet of food and liquids. BRATT diet is something that we've used for many, many years in discussing what's the best foods to consume while you're pregnant. BRATT diet stands for bananas, rice, applesauce, tea, and toast. Now you can follow this and just take these on a daily basis, or you can take variations of this. Again, bananas, rice, applesauce, tea, and toast. Now we've talked about BRATT diet, bananas, rice, applesauce, tea, and toast. I want to mention a couple other things that I think work extremely well. Blue chips, they work great. And blue chips are blue corn chips that you just buy in the potato chip aisle. Obviously, the organic would be the best for you and your baby, but blue chips work extremely well. The last food item I'd like to discuss is ginger. Now, ginger is a root vegetable that works extremely well at helping nausea and vomiting. Now, you can buy ginger as a root, cut off small pieces and chew it up and swallow it, or you can just keep the ginger in your mouth as a lozenge type of material, and that will help your nausea and vomiting. The frequency with which you consume these is very, very important. We talk about frequent small meals. Now, what does that mean? Well, in a normal diet, most people eat 3 times a day. Frequent small meals would be consuming double that or even triple that, 6 to 8 to 10 times per day. Now, as far as intake of fluids, what is the best? Well, obviously we want to replace electrolytes, especially if you're vomiting. What's the best liquid for electrolyte replacement? I'm going to give you a couple of examples. NOOMA is an electrolyte substance. It's organic. You can buy it over the counter. It has a lot of electrolytes, doesn't have a large amount of sugar, and it works very, very well. The second is something called ROAR that is organic, has electrolytes in it, has small amounts of sugar, and it would be a very good option as well. The third option is coconut water. Coconut water has a large amount of electrolytes, it doesn't have a lot of sugar, and it works very, very well. Now those are items that I encourage you to consume on a daily basis. Next I want to talk about medications, and I want to talk about medications in a home remedy or over-the-counter fashion, and then medications that your doctor may prescribe for you in a prescription form. Since the 1950s, we've used a combination of vitamin B6, various antihistamines, in combination for proactive management of nausea and vomiting. Vitamin B6, 25 milligram tablets 3 times a day, every day. Add to that doxylamine. You can buy the over-the-counter doxylamine by itself, or it comes in a medication called Unisom Night Aid in the dosage of 25 milligrams twice a day. They work extremely well proactively in diminishing or decreasing nausea and vomiting. Now, I will mention that this is also a prescription medication that your doctor may prescribe for you called Diclegis. Now, the problem with Diclegis is the expense. Very, very expensive, and some insurance companies won't pay for it. So again, going back to vitamin B6 and the Unisom sleep aid, it's the same medication as Diclegis. Another medication you can use is Benadryl or diphenhydramine. Benadryl has been used for years and years as an antihistamine, but it also works extremely well for nausea, vomiting, and pregnancy. I'm going to mention a couple medications that your healthcare provider may provide for you. Zofran is probably the #1 prescribed medication in all of medicine for nausea, vomiting, and pregnancy. Zofran I've used for years and years. It works extremely well. It comes in an oral form that you swallow a tablet, or it comes in a medication that you put under your tongue and dissolve. Zofran is a generic drug now, and it's a lot less expensive than it used to be. A couple other medications that your healthcare provider may offer you. Vistaril is one medication. Compazine is another medication. And these are all safe. They've been used in pregnancy for years and years. Nausea in pregnancy is very, very common for most pregnant women. Again, it starts early in pregnancy, around your 4th or 5th week, and typically goes until the end of your first trimester, which is around 13 weeks. Now, it's important to understand is as your nausea is improving, somewhere between 10 and 14 weeks, sometimes women get anxious because all of a sudden they start feeling better and they become fearful that something is wrong with their pregnancy. Remember, the nausea and vomiting improves between 10 and 14 weeks, so you should be feeling better. That's a good thing. So don't be concerned that something is wrong with your pregnancy at that point. Hope this was helpful today. Have a great day.